I started filming this video and then I was like, oh, maybe a diagram would be useful to explain this. So then I spent an hour drawing a diagram. But hopefully it's helpful. I just haven't had very much food this morning. I went to get a blood test. Sorry I didn't upload much last week. I just had to take some time to focus on my health because I had a lot of appointments and basically I just didn't have time to film, and lots of different days where I had to get some samples taken and blood tests and things. But this morning I handed in the last sample that I need to take for a while and did my last blood tests for a bit, so it'll be interesting to see what the results of those are. These are like the ready-made crepes. The brand is Marcel's that you can buy in New Zealand. They're gluten-free and dairy-free. They don't taste horrible. It tasted a little bit like cardboard, but not terrible. I just feel like some sugar. And I've got a nice little peppermint tea all ready to go once it's cooled down. In a mug that's like quite similar to a mug that I'm making at Pottery. My friend Morgan got me this one. I really like the glaze, how it goes from pink to yellow and it's like blended. I was definitely getting hungry. I had just like mentally been preparing myself for like having like surgery and recovery and all that, and then it didn't happen, which I'm quite relieved about. I think it's a good thing because, you know, now I'm not having to spend the summer recovering. It's an elective surgery, so it's something that I can do later, but it's definitely something I want to do at some point. But yeah, this just gives me the summer where I can tan and swim and things like that and not have to worry about any scarring healing up or doing more physio on top of like my leg and stuff. So I think it worked out quite well. And there's no point in taking unnecessary risks when I don't have to if it's like an elective surgery. If it was like emergency, they would have just done it, and there's ways to get your calcium levels in your blood under control. But if it's an elective surgery, there's just not that much point in rushing ahead with that when I could wait a bit longer for it. Oh, peppermint tea is so relaxing. So I asked you guys on a poll if you wanted to see 25 life lessons that I learnt by 25, which is definitely a video I want to make, so that will be coming up in the future if that was your preferred choice. People said that they wanted to see a video about what EDS is, like the different types of EDS, and I obviously live with EDS, so I guess it's interesting to hear someone's perspective on it that lives with it. A lot of people that follow my channel probably have EDS and probably know about it already, but for those people that don't know about it, it's nice to be able to make a video that explains it a bit, just to create a dialogue around it and give people more understanding. You know, there's lots of information out there about it, but it is like quite a complex condition to have, and I guess it's difficult for people to get their head around it sometimes because it's not always very visible on the outside what people are going through. So that's what I enjoy about having this channel, is just being able to share my experiences. Like, what can I say? Don't rely on everything that I say in this video. This is just the knowledge that I've learnt from what specialists and doctors and people have told me and from the reading I've done on the internet. But there's advances happening all of the time. New research and papers are being published constantly. There's the Ehlers Danlos Society from the UK. It's one of the channels where I've gotten quite a lot of information in the past, and I do follow them on the sort of channels I recommend page on YouTube. So if you would be interested in learning more about it, there's that. I follow an American girl, Mikhail Jancy, that also has Ehlers Danlos Syndrome. I think she's got lupus and a few other things going on as well, but she's also on my recommended page. And Amy Lee Fisher was also quite well known for putting out videos about EDS. So for me, like, I just wanted to share my perspective on it. not a professional. I don't have all of the answers by any means. I'm just trying to live with it and figure it out as I go along. And this video is for people who are interested in learning about it. And if you don't want to hear about my chronic illness, or you don't like this type of content, there's absolutely no need to watch it. You can just click off it, go on to another channel, watch what you like. But this is for the people that I guess can relate to this or want to learn more about it. So there's my disclaimer. Let's get this diagram out that I spent an unreasonable amount of time on. EDS is a rare genetic disorder. The collagen that's in your body is not as strong as it's meant to be. So you have collagen in your eyes, in your skin, in your muscles, in your bones, in your organs. It's basically like one of the main building blocks of the body, or one of the main fibers that holds all of your tissues together. An analogy you could use for having defective collagen is basically if you were to build a house, but you just used aluminium nails and screws for the house. Aluminium is not very strong, it's too malleable, it's too flexible, and that's basically a very simple metaphor for what EDS does in the body. That's why people get a lot of dislocations. That's one of the main symptoms, is dislocating things, and it doesn't have to be anything very extreme. It could be just pulling something or pushing something and my shoulder will pop in or out. I've had a lot of dislocations in my hips. My kneecap will often get dislocated. My foot's been dislocated, like my ankle, my fingers. That's really painful. This is how my geneticist explained EDS to me when she diagnosed me with it. There's different types of EDS, right? And people often think of them as removed from each other. Like they're specific subtypes that all have a specific gene mutation, and that causes a certain type of collagen to be defective within the body, which impacts the body in different ways. And this is true to some extent, but she also told me that EDS can be seen as more of a spectrum. So if we think about it in that way, then HSD, hypomobile spectrum disorder, is probably the mildest form. The collagen may be impacted somewhat because the person with it, their body is so hypermobile, but there is no genetic basis or no genetic mutation that's causing this. It's simply hypermobility maybe runs in your family, and so you are slightly more hypermobile than some people, but there is not necessarily any genetic mutation. And that doesn't mean that it can't be very severe for people that have hypermobility spectrum disorder. You know, some of them can be very hypermobile, but they just don't have as much like organ involvement and as many of the other issues that come along with EDS as the people who have certain types of genetic mutations. So people with HSD can still experience like joint pain, perhaps slightly lower muscle tone, but often many of them will become, you know, like good gymnasts or, I don't know, good pianists or something, because they can spread their fingers quite far and wide. They will often go into things that having flexible joints is an advantage to you, but perhaps after like 5-10 years of being a skilled gymnast or longer, they're noticing that they're getting several tears and joint injuries and perhaps constant joint pain, or they're like overextending their body. The next subtype of EDS, as it was like first conceptualized, is hypermobile Ehlers Danlos Syndrome. Now they do believe that this does have a genetic basis because there are certain parts of the body that exhibit symptoms, and these symptoms are often tied to specific types of collagen, but they haven't been able to find the gene that is causing the hypermobile type. That can be very mild, closer to HSD. It can be just minor organ involvement. Maybe you have some easy bruising, you have some fatigue, a little bit of low muscle tone and joint pain, all the way up to people with HEDS have postural orthostatic tachycardia syndrome, which is a form of dysautonomia. So the signals between the nerves in the body that regulate things in the brain have gotten a little bit haywire. It might be some neuropathy, so some nerve damage, where it's difficult to regulate your blood pressure, it's difficult to regulate your heart rate. People could faint or have issues with their digestion. And in the more severe forms, like people get gastroparesis, where it's basically like their stomach is paralyzed, like the electrical signals that are communicating from the brain to digest the food are getting like completely mixed up and cross-wired, and your electrical impulses in your stomach are either basically non-existent or like all over the place and just doing completely the wrong thing, so you can't digest food. People can get quite severely ill with that, and so then you sort of end up going down the spectrum of the severity to having more symptoms around digestion and neuropathy and causing different issues like that. So I originally got diagnosed with classical Ehlers Danlos Syndrome. I went to see a rheumatologist who diagnosed me with this, and I met all of the clinical criteria for it. So with classical EDS, there's a little bit more skin involvement. So some people with hypermobile have quite stretchy skin, but classical, the way they define it is by how stretchy your skin is. So I don't know, I don't feel like mine is super stretchy compared to some people, but it definitely has more elasticity. So basically people that have the classical type won't have many wrinkles because the proportion of elastin to collagen, I think, is like different than with normal skin, but don't quote me on that, I'm not sure. But basically it's just like more elastic and you can pull it out and then it'll just snap back straight into shape. But I think, yeah, sometimes it is like a little bit looser maybe than what other people's skin is. Like sometimes I put my hands under those like drying machines after you've been into a public bathroom and my skin will just be like flapping in the wind. It's so funny. I sometimes think my face looks like a little bit puffier or a little bit looser or inflamed maybe than normal skin, which is like a bit tighter, but it does get wrinklier easier, especially if I haven't slept. I can get very puffy eye bags. But luckily I think I slept well last night, so that's good. I met all of the clinical criteria for classical Ehlers Danlos Syndrome. I had atrophic scarring, which is like where scars don't heal properly. He measured how stretchy my skin was on different parts of my body, so like how much the skin on my knee stretched, how much the skin on the top of my hand stretched or in the palm of my hand. And so I did meet all of the criteria for classical EDS, most commonly caused by gene mutations in the COL5A1 or COL5A2 gene. In your genome, there'll be a mutation of one of those genes, and then that causes defective production of either type 1 or type 5 collagen. So that's what I thought I had at that time, and then I'll get to what my geneticist said when I went to have proper genetic testing, and she made more of a diagnosis by exclusion. Then you have classical like Ehlers Danlos Syndrome, which is caused by the TNXB gene, and this doesn't actually cause faulty collagen in the body. It impacts the production of a fiber or a protein called tenacin XB. However, people with that genetic mutation have very similar issues to people who have a gene mutation that affects their collagen. So often with those people there might be some more endocrine disorders or like adrenal issues and things like that that go along with the hypermobility, some of the heart issues and things that can come with classical and classic-like. I think they're more likely to have mitral valve prolapse and enlarging of the aorta and things like that. Finally, the most fatal and severe type of EDS, if we don't go into all the other rarer types, because there are like more types, but they're like extremely rare, like periodontal EDS, or I don't know how to pronounce the other ones, but yeah, I'm not going to go there because I just don't know enough about that. But out of the most common types of EDS, vascular EDS is definitely the most severe. That causes complications with the COL3A1 gene and the COL1A1 gene. This affects type 1 collagen, same as classical EDS can affect type 1 collagen. So you can have a little bit of a crossover there, but vascular EDS is much more severe than classic usually. Oftentimes people with vascular EDS will have a massive cardiac event before the age of 40, and life expectancy is around that time too. Vascular EDS and the defect in this specific gene causes really serious issues with blood vessels and organs. So often people with this could have an organ rupture, like a spontaneous organ rupture. Their aorta could burst open, they could have aneurysms or hemorrhages. So it's definitely the most serious and the most lethal type of EDS. So when I went to my rheumatologist, I got diagnosed with classical, and I met all of the clinical criteria for classical. But I think like internationally and with the Ehlers Danlos Syndrome Society guidelines, they say that if you meet the criteria for like any type of EDS and perhaps even HSD, that you should go to a geneticist and you should get your diagnosis either confirmed, or you should rule out the more severe types so that you know you don't have those, and then they can give you a diagnosis by exclusion, I think it's called. So then I visited my geneticist. I finally got an appointment with someone at Auckland Hospital. I had a meeting with her and my mum, and she explained to me that this old type of way of classifying specific individual types of EDS has some merit to it, and it can be true that, you know, people in one specific kind of group, or they show symptoms of one specific type of EDS, but she said that she conceptualizes it more as a spectrum, and that's more of what the new research coming out is saying. You can have symptoms from multiple categories of EDS. If you have hypermobile, classical, classic-like EDS, people can have severe or mild symptoms of those, and they can have similar issues as well, and issues that overlap. So I told her that I had been diagnosed with classical. She said that she felt like I had features of hypermobile and classical on the, like, I guess, spectrum of things, on the spectrum of symptoms here at the bottom. We can have a look at like where I fall. I do experience joint pain. I am hypermobile. I met the criteria for the Baton score, or the Baton test, which is one of the screening tools that they use to diagnose Ehlers Danlos syndrome. What I would say about your Baton score, or the Baton test, which I can again attach like more information about this below in the description, is yes, some people can be very like hypermobile. Like for example, I can bend my finger back like quite far, and that doesn't hurt me or anything. Like that's just naturally how far it bends back. And then I am also like slightly double jointed, so I can like bend that. With a Baton score, you basically do different things, like bend your pinky back, and if your pinky bends back past 90 degrees, that's a point on each side of your hands. Touch your thumb to your like arm, which I could do extremely easily. That's another point for each hand. Then if you can touch the ground with your palms and your knees are straight, that's another point. And so you go through this whole checklist. Even if you don't pass everything on the checklist to meet the criteria, but you still have a lot of symptoms of conditions that can come with EDS, or symptoms of you know, like organ involvement or fatigue, bruising, neuropathy, like you might still have EDS. Your bones or joints or muscles might be just shaped in a certain way so that you can't hyperextend them as much, but the collagen could still be faulty. So I don't have like extremely hypermobile arms. Like a lot of people have super hypermobile arms, and this one's more hypermobile. It's difficult to show you on here, but my arms weren't like super hypermobile, and so I thought I wasn't going to get a point on each side for that, but I did. And like, I don't know what it is, but like I have defective collagen, like I do dislocate my elbow, but the joint just can't move past this point, and I'm not sure if it's the way things are shaped or attached, or if it's because I haven't overused that joint very much. But even though the joint is not hypermobile, what I'm trying to say is it can still be unstable, and you can still meet the criteria for EDS, or you could still have a gene mutation that causes defective collagen, and you could still have defective collagen. What I would say is like, don't go too much by the Baton score. It's a good screening tool to see if you're hypermobile or if you have EDS. But if you think that you've got things going on with your body and the symptoms are matching up with EDS, I definitely would recommend going to see a rheumatologist and going to see a geneticist. And unfortunately, in some countries, because EDS is so new, there aren't as many guidelines for treatment options for patients. There's no ready-made pathways here that a doctor can refer you to a rheumatologist, and that rheumatologist will for sure know all about EDS, or will be able to refer you on to a geneticist. In New Zealand particularly, it can be very difficult to get an appointment with a geneticist. I was very lucky to see one. Many people are sort of forced to try to manage their care through their GP or themselves, and that's quite sad and quite disheartening, because it is a complicated condition and it's lifelong, and it's something that stays with you. And even if you have a fulfilling life and you're able to do lots of things that give you enjoyment and purpose, it can be stressful knowing that you've got this in the background, and sometimes it's good just to have a little bit of support from specialists or a really good family doctor or family that are able to check you or call you out and say like, hey, you haven't been taking these supplements, or I notice you haven't been taking the best care of your body lately, because we can all get burnt out and no one's perfect. So I think it's good to have those people that you are close enough with them that they can hold you accountable. Of course, we're all responsible for ourselves and our own bodies, but I think we are all interconnected as well, and we all have people that we care about, and I think it's good to make sure that the people that we care about are taking care of themselves and feel supported. Definitely, if you have symptoms, more and more people are getting training around this and developing knowledge around it all the time. I'm moving to Sweden because I know there are specific EDS clinics there that are designed to help people go to physio, eat the right type of nutrition, do the right types of things, so that they can prevent complications and other things from happening down the line. And I think it's more of that kind of holistic and preventative care that patients with EDS need. So I'm very much looking forward to heading over there and seeing the different types of support that are on offer there. Even though internationally there's a lot of studies and a lot of evidence and good specialists all talking about this right now, it doesn't seem to have translated or caught up over here. We've just got to keep on standing up for ourselves and stay strong in what we know about our bodies and what we're feeling, and just keep on talking about it, keep on creating conversation about it, and eventually people are gonna have to acknowledge that it's a thing that's happening, because people with EDS aren't just gonna go away. Disability, illness, it's all a natural part of life. EDS is part of your genetic code. It's part of what you're made up of. And so I think for me it's been much easier learning to live with that and just recognizing like no one's perfect. We are all going to encounter illness or disability at some point in our lives. It's natural. And for me, I am made up of collagen that's defective, and that's okay. I can still make my life what I want to make it and do what I want to do. So that's been a really empowering perspective to look at this whole situation with. But yeah, there seems to be sort of an illness hierarchy as well of certain diseases. Like obviously cancer can be like fatal and it's very serious for people, but other genetic conditions as well that are just more well researched or have better established guidelines of how to treat them or what to do. They'll sometimes have doctors or specialists that just specialize in that condition or that area, or there will be a wing of the hospital that deals with specifically those patients, or they have helplines that they can call if they need help, that are trained to support them and have the knowledge of that specific condition. And we're just not there with EDS yet, unfortunately, and it's taking a bit longer for things to catch up. Anyway, I was saying that I experienced joint pain, low muscle tone, fatigue, easy bruising, neuropathy, and I'm currently under investigation for some like endocrine disorders and things like that. My geneticist said I had features of both hypermobile and classical EDS, so I fall somewhere in the middle of these two on the spectrum. It was a diagnosis by exclusion, so they tested me for all of the known genes of EDS and I didn't come back positive for any of those. So in one way, that was like a real relief. It was like, oh, phew, like I did not meet many of the criteria for vascular Ehlers Danlos Syndrome, but I know for sure that I don't have it. So that was a big relief, and also a relief to know that I don't have any of the other rarer or more severe types. But then also slightly frustrating because there's so little known about EDS and the management of it is so poorly done in New Zealand. I did feel like if I had a positive on one of the mutations for the COL5A1 or COL5A2 gene, no doctor could dispute that, just shoving me off to different doctors. They don't want to do the wrong thing, or they can't admit that they just don't know how to help and they just don't have the knowledge. So often if you don't have a like clear genetic diagnosis saying like this gene is mutated and this is the type of collagen that it affects and this is how that manifests in the body, people will be much more inclined to dismiss you, gaslight you. I didn't want to have to deal with that anymore, so I was slightly disappointed that we didn't have like all of the answers yet, and that it was a journey that I was still going to have to continue. And maybe they'll find the gene that's mutated for me in my lifetime, or maybe they won't. But my geneticist made a diagnosis by exclusion, and this is what I think everyone that has EDS in New Zealand should be entitled to, because most people here have not seen a geneticist, so that they can rule out that they don't have any of the rarer types. And now my DNA is on file at Auckland Hospital. She was like, you could have classical Ehlers Danlos Syndrome, but you could have a mutation in one of the genes that we haven't discovered could have a gene mutation in it yet. And there's ongoing research all of the time overseas of people trying to find different gene mutations so that they can perform tests on people, but also so that they don't get mismanaged or people can't fob them off. Same with hypermobile Ehlers Danlos Syndrome. If they find any new genes that are mutated that could be causing that, my DNA would also be tested and they would get in touch with me if it was positive. That's quite reassuring for me to know. They haven't dismissed me, they haven't given up on that. They'll find it. Like, she just handled everything so well. I really appreciated that appointment with that geneticist because it just put all of my kind of uncertainty to rest. And I'd had so many doubts about different aspects of my health, and she just said, hey, look, this is absolutely something that's happening to you. You are meeting several of the criteria for classical Ehlers Danlos Syndrome. You're meeting several of the criteria for hypermobile. You already have a clinical diagnosis for one of these, and a clinical diagnosis on its own, if that's all you can get, that should be enough. Doctors make clinical diagnoses of things all of the time. She confirmed my diagnosis of Ehlers Danlos Syndrome. She said that I had hypermobile EDS with classical features. And, you know, I had the organ involvement. I had all of the other comorbid conditions that so often go along with EDS, and that's a whole nother video if you guys want me to talk a bit more about what comorbid conditions EDS has caused for me and what the symptoms are of those and how that happens. I can do that as well if people are interested. I'm kind of a complex case because I have features of both. And I'm so grateful that mine is not very severe. Like, I'm dealing with some issues at the moment. I do have joint pain, low muscle tone, fatigue, easy bruising, neuropathy. I'm under investigation for endocrine disorders. I have like POTS and dysmotility, so I've got some organ involvement and some involvement of like my heart and my blood vessels, but all in all, it is very well managed with medication. I've got medication that I can use to heighten my blood pressure so that I don't faint. My heart rate is under control with beta blockers. I love doing physio and exercise, and I've been loving wheelchair basketball, and that's been really good for my arms. By strengthening my muscles, it's better able to hold all of the different parts of the joint together and make it more stable. But when I was at primary school, I think I was like 5 or 6 years old, and we had a relief teacher. She wasn't like one of the main teachers. She'd been on a skiing trip, and she came into the class and she had her shoulder in a sling, and then she sort of explained to the class or showed everyone why she needed to have her shoulder in a sling. She said she couldn't lift her arm above a certain height, and she'd had surgery on it because when she went skiing she dislocated it. And then she asked the class if anyone else had dislocated anything or if anyone else had similar injuries. And I said, oh, my shoulders popped out of the socket before. But normally for a person that doesn't have defective collagen, that would never happen when you're young or without doing something very traumatic to your body. So like for most people, a large amount of force is required to dislocate something. So it could happen during a rugby match, a car crash. For this teacher, it happened during her skiing vacation. I guess she was holding onto one of the poles or using one of the poles, and the force of her body against it just forced her shoulder to pop out. Then when I was telling my story of how I was just, I don't know, playing sport or going about my day or something, and my shoulder popped out, she seemed a bit dubious and a bit skeptical about that. And I can't remember how it came up, but I started talking to my mum about it. I was like, oh, don't you think I've dislocated my shoulder before? I'm pretty sure I have, like, it didn't look in the right place. And then I was forced to, I don't know if the teacher demanded an apology or if my mum told me to go, but I ended up having to go back to school and apologising and saying, oh, you know, sorry, I didn't mean to make light of your dislocation. Turns out that I haven't dislocated my shoulder probably, and so I'm sorry for lying, type of thing. It felt quite unfair to me at the time. I think I was like 7 or 8, maybe 9. Oh no, we'd moved to New Zealand, so I must have been 9, 10 years old. Because I did dislocate my shoulder, and I had dislocated my kneecap, and it wasn't very noticeable, but when I was younger, I guess maybe more it subluxed, which is when the joint is like halfway out of the socket. It's not completely out of the socket, but I could still play sports and run, and I had really strong, good muscles in the collagen and keep my joints in place. So I really didn't notice any symptoms of EDS when I was younger. I wasn't in my teens anymore. I guess I was like 19 when I noticed my first symptoms of it. And I've got a video about that if you want to know how I found out that I had a chronic illness. It's quite common for people with EDS that they don't notice many symptoms when they're younger. Some people that have a very severe form of it will be born with, I think it's called hip dysplasia, where their hips are dislocated when they're born. I missed some physical milestones. If you have very lax tissue and low muscle tone and like floppy muscles, it can be difficult for you to learn to walk at the same time as everyone else or crawl. So when I was little, I used to do this bum shuffle thing where I like sat on one leg and pushed myself forward and the other one was in front of me, and I would sort of crawl like that. And everyone else was just like crawling on all fours, and my mum was like trying to teach me to crawl, and I was just like bum shuffling, and she was like, okay. So there are a few signs when I look back, but not an awful lot. And mostly people start to notice a change or a difference in symptoms when they hit either puberty or it'll be in their mid to early 20s. So I guess what I'm trying to say is that for a lot of people, EDS doesn't get caught when they're young. And that's why I think knowledge and diagnosis is so important, because it is genetic. And so if it runs in your family and you see that someone in your family is displaying signs of it, you can help them get physio to strengthen their muscles when they're young. You can do lots of things to prevent any of the symptoms or complications that can happen with the condition from getting worse. The research around EDS is reasonably new, like as we know it in its modern form with the different classifications. There's all sorts of interesting research about how hypermobility can overlap with neurodiversity and all of these other conditions. Does the defective collagen impact our nervous systems and how we sense things and how we regulate our emotions? Like perhaps that could be a link with EDS and neurodiversity. So there's lots of interesting research out there. One of the more interesting people, I think, that they have discussed could have EDS, and this is one of the doctors, I think, published a book. It was the doctor that did the autopsy on Elvis, and he also did the autopsy of a really famous pilot who he thought had EDS as well. But this is the doctor who's done the autopsy of these two men. If I remember the name of the book of the doctor, I will list it in the description below so you guys can see that as well if you're interested. But he believed that Elvis Presley actually suffered from EDS. Some of the reasoning for this was clinical evidence that he saw when he did the autopsy, but also he argued that Elvis wouldn't have been able to do like all of these different gyrating dance moves or kind of contorted his body in all of these new and interesting ways unless he had EDS, because he was very hypermobile and very flexible, and he used to sort of jump up onto his feet and do all these interesting dance moves with his microphone. And this doctor argued that he wouldn't have been able to sing and keep his voice steady and do these very complex maneuvers unless he was hypermobile and he was like overextending his body. So that was quite interesting. And of course he died at a really young age, and I think part of that is just the pressure of constantly having to perform, constantly putting your body through so much stress, especially if you already have an underlying condition. Having people that rely on you financially, and then him having to go out and perform every evening to satisfy people that had bought tickets and to be able to support his family and his crew and management and whatever else goes into all that. He lived a very stressful and extreme lifestyle. We'll look at celebrities or people that constantly have to perform or have like an insanely high physical output, like athletes and stuff, and you know, some of them do resort to drugs, amphetamines to keep going, painkillers, just because it's not, humans are not designed to do that every day or every night. I think a lot of people have looked at Elvis or other people in the public eye and thought, oh, why are they relying so heavily on medication? Why do they make this choice of kind of using medications and painkillers, and then after they've used amphetamines, like they would have to use barbiturates to be able to go to sleep and calm down in the evening. But it's difficult because EDS is also a condition that does cause pain and stress on the body, and some medication might be necessary in order to just have a good baseline and live a good functional life in some cases. So it's interesting to think about whether it was the drugs and his lifestyle that worsened his health and caused him to pass away so early, or if he did need some form of support and medication and therapy, but there wasn't any knowledge about EDS at that time, and he was checked into Memphis Hospital several times and they just had no idea what to do with him. They knew he was very ill, but they weren't sure what to prescribe him or how to help him. So yeah, it's interesting to think about. He was trying to self-medicate to help his condition. When he passed away, he hadn't taken care of his body. He looked, you know, like swollen, and you can tell that he's got very hypermobile skin because he didn't have any wrinkles. They said when he passed away he had an enlarged heart and an enlarged colon, and so these are things that can happen if you don't have enough collagen in your organs. They stretch and that can cause complications. But yeah, total side note, there's not a long history of people having been diagnosed with Ehlers Danlos Syndrome. Unfortunately, I think that many people who have suffered quite bad symptoms from it have just been left alone to cope with it. So I'm just so grateful and immensely happy that I live in this time where there is more research, more knowledge coming out all of the time. I know that this is not something that I'm just going through alone. There's lots of other people that have this and go through this, and there's things that you can do to manage. Genetics is such a fast advancing field and there's so many discoveries being made constantly. So I'm definitely excited to see what knowledge will be uncovered in my lifetime. So yeah, I hope that was helpful. I feel like it was somewhat jumbled, but EDS is a very complex condition and I'm not sure that there's a simple way to explain it. What gives me the most joy and the most meaning is with this channel is being able to talk about it and put knowledge out there for other people that just don't know that this is something that people could be dealing with or could be living with. I think it's always a good thing to educate ourselves about other people's experiences and what other people could be going through, and to become just more empathetic, kind people. I don't think that anyone can lose anything by doing that. And I benefited so much from other people's videos that they put up online when I knew something was wrong with my body and I was scared and I didn't know where to go or how to get help or how it could affect me. Just listening to other people who'd been through the same thing and they got out the other end of it, or they managed to see and find the right people and the right medications to help them, and then just seeing them like living their lives like happily and moving forward with their goals and what they want to do is just, it's so rewarding, and it gives me hope as well that I can do that. I want to pass that along. The most rewarding thing for me would be if someone resonates with it and it's able to help them in some way. You know, I think we can all relate to each other in some sense. And there are always other people out there who are going through a similar thing to you, and I just think that's what's so beautiful about social media, because there's so many negative aspects to it. But I think that's one of the more beautiful things, is actually how interconnected we are as humans and how we can find information that can resonate with us on such a personal level from other people all over the world. That's quite a profound note to end on, but I think I'm gonna leave it at that. Okay, bye.